Mental health with an India lens. Real stories, real conversation, real
On the
talk.
23rd of January, though, I sat in my Bombay flat reading 7 books.
Hi, everyone. Thanks so much for joining us for another edition of Health Collective Talks. I'm Amrita Tripathi, and I'm really delighted today that we're going to be in conversation with social psychologist and founder Anna Chandy and Associates. Anna Chandy herself joining us. Thanks so much for taking the time.
Thank you for this opportunity, Amrita. I really look forward to this conversation.
Me too. And as we just discovered, I'm all that's standing between you and your break. So we're going to make it count.
Yeah,
It's
absolutely.
it's really great to chat with you, Anna. We're here to talk a little bit about the counseling handbook you've just released as a free resource. I want to ask you a little bit about that and who it's intended for, how it should be used. But let me just take a step back and ask you first, a bit about your own journey. The last 2.5 decades. What are some of the highlights? What's something you're particularly proud of? Because you've really seen the mental health journey in India, right? From nascence to where we are today. How would you map that trajectory?
So 27 years now seems such a long time when we started. I think in the early years, what kept the momentum and gave me the fuel to continue is really the passion, because I myself learned so much about myself in the early years, especially during the process. And as you're aware, I've written about it in my book, which was Battles in the Mind, published by Penguin. I had my own narrative and my own story, and therefore, working in this domain was an additional benefit because you got a lot of insights about yourself. So that was really the fueling of the early years. Now, when I look back, 27 years is a long time, but I think what really kept me going was the personal rewards you get in this work. Commercially or monetarily may not be much in comparison to other domains, but that personal reward you have comes in the form of relationships, which are deep relationships from with people from different walks of life, uh, and give you different perspectives of life, and you get a flavor of what I call the other, whoever they may be, the other outside you. And I think that was what really kept me going. And even today, as you're aware, today is the last day that I'm working for this year. But from January 2020, I've not even, had a weekend off, of course, because of the pandemic and the issues, that rose because of that. So that's what really has kept me going.
No, it's incredible because I think this has been such a traumatic year for so many people. It also seems to be the year where we're seeing mental health vocabulary issues in some ways come into the mainstream in India. What are your thoughts really or reflections on this year as we exit? Because you like you said you've been talking to people. A lot of people are in crisis across the country as well. How do you feel we're moving into 2021?
So I think I'd like to take a step back. I think from 2013, 2014, the conversations around mental health had therefore started increasing and coming out into the open much more. There were several people working really hard, those in advocacy, those from the medical fraternity, psychologists, people in the legal field, some journalists, etc. So there was a lot of input, and therefore I think we were slowly coming out of the shadows of stigma. We were taking it was slow, but definitely there was much progress. Unfortunately, with the pandemic, uh, I was a bit sad, and I am a bit concerned because there were several people who in a way hijacked the conversation, and they trivialized and minimized mental illness, and especially those of the sufferer and the families of those suffering, by making judgments and passing harsh comments, which in a way I think has possibly made us have a setback in the dialogue, in the discussion. So I'm hoping that in 2021, we would be able to move forward and overcome the setback with more and more people coming forward and more people actually being able to address issues, mental health issues, as part of some of our social and psychological issues in our country. That mental illness is not purely a biological issue, that mental health is also influenced by some of the prevailing social issues and some of the prevailing psychological issues.
No, I'm really glad you brought that up. I did feel this summer actually for the first time quite distressed at where we've reached in the sort of national mainstream dialogue, and there's no sugarcoating some of that. It sometimes feels like one step forward, two steps back. I've asked quite a few people, Anna, especially because given the work you've been doing with the Live, Love, Laugh Foundation as well, somebody like a Deepika Padukone coming out a few years ago, speaking openly about depression, the kind of impact that has. I do want to take a moment to recognize that, Lord, the courage it still takes in India today, right, to talk about, because that stigma is not, many stakeholders are trying, but that stigma is not gone completely. Do you feel that was one of those watershed moments you're referring to? And if you could also bring in maybe one or two myths that you think everyone should now be done with.
I think absolutely. I think for me, she really had at that point a lot of courage to be able to come out and share something that was so deeply personal, something that is so deeply stigmatized, and also take the risk of sharing it at the time when her career was in a good space. So there could be possible consequences, and I think that was really, really a landmark moment and in the area of mental health. So I think that was one thing that we really need to give her credit for, not just because I know her personally, because I meet so many people who actually have shared that, because of her story, they were able to talk about their own narrative. Till then, they were scared. So I think we need to give her the acknowledgement for that. Coming to the next part in terms of the myths, two myths. One is, which I always tell people, one is that depression and anxiety, it happens only to a certain strata of society. And I think that's a complete no-no. The last 1 week, I was in a small town in off Madurai. It's a small town called Rajapalyam. It's about an hour and a half from Madurai. And I met a lady from the rural area, from the poorer class, and she had brought her daughter, and the daughter was clearly suffering. And the mother was able to understand that she's suffering. She may not have a name to it or a tag to it or a label, but she clearly knew. So this assumption that it only happens to a certain social strata, I think that's a complete myth. The second one that I always talk to is, people keep asking me, oh, she didn't, so and so doesn't have anything wrong. They're smiling and giggling, you know. So they can't be having depression, because they associate depression only with immense sadness and anguish. And I say, no, that's a front, that's a cover. And then, of course, unfortunately, I share the example of Kate Spade, who had smiling depression. And I said, did anybody see that what the pain she was going through, and what effort and energy it takes to just every day put up this, smiling kind of appearance? So these are two myths that I really think we need to really, really do away with.
And sometimes I feel it's that vocabulary which is also tripping us up. We talk about depression so easily now that if I'm having a bad day, I sometimes say, like, if I have the grays, or I say I'm depressed, it's not the same as someone who's suffering depression, but I might equate the two and then just say, look, I snapped out of it. Why couldn't they? We seem to be very snap judgment that way.
Yeah. So I think that's one of the unfortunate outcomes of what we call common parlance. In common parlance, when you say I'm depressed, what you're trying to say is I'm of low mood today. But when we're talking about depression, we're talking about a clinical illness. And I think we need to have education and sensitivity and awareness to be able to separate the two. Very often the two are entangled, and people therefore misunderstand and misperceive.
So let me come then to this manual you've just released. It's again like for those of you joining and listening to this conversation, it's a free resource available to download, and we link to where you can download it from. I started going through this, and you talk about the spectrum of health. You talk about common mental health disorders, even stages of grief and loss, caregiver stress. There's a lot in there. And I thought also it will be important to note that you say it's not a diagnostic tool, right? It's something that you want to use. Why don't you share with us, who it's meant for, how you would intend for it to be used, and what kind of impact it can have?
So one is that I'd like to say that that's been one of my COVID lessons. And I've really begun actually with COVID to understand at a deeper place in my own being, the power of generosity, whether it is generosity of knowledge, generosity of skills, or whatever you want to be generous with. So that's why it was given as a free resource. The second thing is I did it because I think what happens very often is people have, say, a master's in psychology, counseling psychology, or some of them have PhDs. That's the theory part. And there is an application part. And sometimes you need to understand how theory is applied. So this manual actually has embedded live videos of me in session with, of course, my associates, but they are real, authentic sessions. You will see people emote. You will see me connecting body and mind. And for me, it is those videos were created so that people who are young professionals or people who want to get into this, they are able to learn through observation. The third part is the reason I say it's not a diagnostic tool is you can't use this manual and say in this manual, you're able to do it as a diagnostic tool, because for that there is a separate diagnostic tool. And the other thing is when people are doing counseling application, they need to have like a handbook that they can use as a guide, just to understand how these application processes. And that was what I wanted to do. And the last is, Amrita, which was very important for me, is in India we are a collective society and we follow the Western models, which is very individualistic. If you look at psychology, it was really born out of Vienna. Okay. And I think so I've written some understanding about the collective society, and therefore how do you work in a system like this. Let me give you a small example. Suppose you come to me for therapy and you want to learn how to be independent and you want to really take charge of your life. 100% you need to do it. But I may need to work with you as a therapist or a counselor. How are you going to take charge of your life and manage these other relationships in the system? So I come from a philosophy that in a collective society, we need how to learn to be independent along with being interdependent. What our confusion is that if we are independent, we confuse it with being intradependent, interlocked. I can be separate and yet belong.
Right.
And
So
if I tell you, oh, Amrita, you need to belong, and we work, and you say, for that I have to cut away from everybody who makes me feel not independent and makes me feel dependent. In a way, I'm promoting you amputating a lot of possible meaningful relationships that give you some fuel or some enrichment. So I think the way you look at this system or the way you work in a collective is a little different from the way you work, say, in a independent kind of way, or what we call an individualistic society. So that's one of the other part of the manual. So basically, I've put in all my thoughts and ideas in the manual. And of course, this is the first version. I call it version 1. I will ask for feedback. I'll do a review, and version 2 will come again. That we keep, fine tuning it and making it better and better for our Indian context.
So it would be, helpful for students of psychology, counselors starting out. You think practitioners across the country?
Yes, because actually very often one of the reaches that I have from a lot of students who ask for internships is, can I observe a session? But a typical counseling session, because of confidentiality, nobody can observe. They can't be in the room.
Right, right.
Yeah, here they can see the live video. It's been shot. There's a
Yeah.
video. The whole thing session is, so it's, you can see it.
Very high tech, very cool. I think it's exactly what we need. When I set up the Health Collective as a site, what I was actually reacting to, I think intuitively, as at that time a journalist and storyteller, was that most of our examples, of lived experience and stories were all actually from the US or the UK. And we realized that, for us to help work on stereotypes or stigma, or even for our own, knowledge, you need kind of examples from India, right? So I completely, that really resonates. Looking at things from this kind of perspective, that's quite unique to the subcontinent. But I do want to ask, that links up to something we realize quite quickly when we're, anyone who's looking at the sort of mental health care scenario in India, is the lack of resources, right? I mean, everyone says we have a huge lack of trained resources. There's that infamous rather WHO study that, we all quote 4,000 to 6,000 trained psychiatrists from several years ago. I do want to ask you then, when we look at what each stakeholder can do or bring to the table, right? There's a focus, like suppose it's journalists or educated lay people. There's a focus on awareness building, sharing stories, creating this narrative and understanding mental health and mental illness from an India lens, which I would say that, we're trying to do with the Health Collective. There's a huge gap and dearth of trained professionals and resources. So where do you think, we need to collectively be putting our focus, and how do you see these gaps being addressed?
I think as you said, we all know about our statistics, and it's public knowledge. I come from a space. I think the time has come in India where we actually train lay counselors who can work in tier 2 and districts, townships, rural areas. And lay counseling, the lay counseling model is about 40 hours of absolute counseling application skills. They also learn how to recognize symptoms. They are not diagnostics, but if when they recognize it, they can recommend uh, the individual for additional support. I come from the space where I believe in that. In fact, this last week I've just come back because I believe so strongly in it. I uh, I just told you I was in this town in Rajapalayam in Madurai, where we've actually launched an initiative called Atma Prasara. The initiative is funded by the Ramco family because they now believe in the counseling process, where we trained 20 lay counselors for a township of 130,000 employees. And in the lay counseling, these are volunteers, and they've been given 40 hours of counseling skills. The manual has been given to them. I will keep going for the next year, every month for 2 days, just so that the whole initiative is properly grounded. And these lay counselors will be doing what we call the first level of psychological first aid. When people feel heard, they feel relevant, they feel addressed, that itself minimizes some of the psychological pain. And that's what you see in the manual, that is what I call the reactionary phase. If you provide counseling support at that stage, then they will not keep going further down in the needle from ease to disease. They will actually start learning how to cope and contain. Now, of course, those who have biologically have mental disorders, they will also, these lay counselors will be able to identify them and get them additional support. So I come from the space saying, yes, we have shortage, and we can keep talking about shortage, but we cannot quickly certify many psychiatrists. Neither can we create many counselors overnight. So let's look at this model. And this is a model that has worked. In Australia, if you want, it's so interesting. Do you know that they trained beauticians and hairdressers in lay counseling? I thought it was so powerful because when you keep going to a beautician or a hairdresser, you do get familiar with them and you do share some. So they've taught them, and I believe it's working very well. In Zimbabwe, they've done it, and again, they've taught, so it's being worked. So I think the time has come for India to look at that model. I am hoping that this Atma Prasara model, in a year down, if it works well, then it can be replicated in other small towns. And I feel corporates who are interested in this can take this initiative and use it the way they would like to do it in their area where they'd like to, serve the community.
No, that's incredible. And I think, we were chatting earlier with Dr. Patel, Vikram Patel, Dr. Soumitra Pathare. I think there are
Yeah.
different models being implemented in India as well,
Yes.
which is very promising. So as you said, no one's going to be able to, flip a switch and get a million trained psychiatrists out there. But what is your suggestion? And if I'm sure you have thought about this or even worked with other stakeholders, what is something that policymakers or those who want to implement at scale, right? What is it that they need to look out for? Any advice from your side there?
I think the first step for me is policymakers need to understand mental health professionals. The reason I say that is, say the Rehabilitation of Council of India, they only recognize clinical psychologists. There is a role for a psychiatrist in India. There's a role for a clinical psychologist. There's a role for a psychotherapist. There's a role for a counselor. And there's a role for what we call mental health workers. I think first, policymakers must understand that all these professionals have particularly skilled competences to work in this domain, and therefore they all need to work together collaboratively and cohesively to build an efficient mental health system. The second thing I think they need to understand is, which again I think is important, that the mental health domain or mental health is influenced by psychological, biological, and social issues. And therefore, you can't look at depression only caused biologically. Depression can be caused because of some psychological issues, which are early childhood issues, or depression can be caused by a social issue like domestic violence. So we cannot look at mental health without looking at the social issues, the psychological issues, and we have therefore have to work in all these domains to build a robust mental health system. So I think these are the two key areas that I would ask policymakers to really focus on and to keep in perspective when they plan how to the way forward, or what's I have policy development.
Sure. And, as we wind down, unfortunately, we could keep asking you questions, I think, all day, given all that there is to talk about.
Definitely.
I do want to ask you, Anna, what is your advice to if we say different stakeholders in this, right? There could be someone watching this who's acutely distressed. There could be someone who's watching this who's friends with someone or is a relative of someone who's going through something, they're not sure what. And I think that's one of the number one questions we get, which is, how do I get them to seek out help? Who should they go to? And also, it can be very expensive, right? When we talk about, finding a counsel and therapy and so on. So how do you address some of those without losing any nuance, I suppose?
I think one is, if you see somebody suffering in any form, is to reach out and support them and bring it to their awareness that you have observed that they're suffering and you'd like to support them. Having said that, supporting means not directing them what to do. First is to pay attention and listen and empathize with what they're going through. Third is to make the suggestion that maybe they need to seek professional support. Now, the next point that you said is, how do they get help in terms of expense? I think now in India, we can get therapists, counselors according to the our affordability. There are several not-for-profits doing phenomenal work. They're free, absolutely free. Somewhere we think if somebody is doing a free service, it's not good. They are good. They do very good work. The second thing I think is, again, this lay counseling model, to be able to actually first encourage them to get psychological first aid. That's the, that itself is the biggest hurdle. then we can look at the other steps.
That makes sense. And then when we talk about, you do address caregiver stress in the manual, and that's something that comes up. I think it's often overlooked. I mean, someone pointed out to us as well that it's not something that is front of mind. Any advice as we're winding down this year? Any advice for caregivers?
I think caregivers need a lot of care. And I completely understand that because I'm a caregiver myself. I have a brother-in-law who has been suffering from schizophrenia, who's lived with us for 32 years. So caregivers do need care. And I completely understand that. And so when I say they need care, they need breaks, they need time offs, they need somebody nurturing them, and they need somebody to hear their pains because they're also anxious being a caregiver, wondering what's going on. I think these are three very, very important things. The fourth thing is I think caregivers need like support systems, a common, like you have family support systems. We need to create those support systems, a space where they have a commonality with the group because everybody understands each other, therefore they can share openly whatever their vulnerable issues are.
Yeah, that would be incredible to see. And I suppose some of that is, it has to be done from the community, right? Directly.
Absolutely. Yeah.
So maybe final question for you then. Though hopefully we'll schedule another interview in 2021 when you're back. Sometimes when we look at mental health and mental illness in India, the scale of what remains to be done can seem very daunting, right? I've spoken to people who, whether it's micro within our own families, our own communities, or macro, because there are so many things that are missing that need to be done. How do you address that, and what's your advice, I suppose?
I think the different stakeholders and different players in this domain actually have to take something that they kind of relate to and identify with. For example, if you look at the foundation, the Live Love Laugh Foundation, our expertise and our competence is in awareness building and destigmatization, and we use different forms of media and different approaches to kind of work in that area. Having said that, since I'm a therapist, I also believe in the service delivery area, and that's why I've started doing this work where I'm supporting organizations that will take up this initiative to lay counseling initiative. So I think different people, if you look at Saumitra, he's doing a lot of work in his domain, and if you look at Vikram and Sangat, they are doing. So I think different people are taking different areas, and I think what I think we do need is if all of us who are players in this area, if we can come together and say, okay, each of us are contributing in this area, but remembering that we all have a common focus. That's been again one of my learnings after COVID, and very importantly is that there has to be a coming together. There has to be a collaboration. We cannot work alone.
That's actually beautiful and quite moving. I think we will end on that hopeful note that we are going to hopefully see more coming together. And as you said, so many incredible stakeholders doing important work, though it sometimes feels like there's so much left to do, but I think we're on the right track.
Yeah.
Thank you so much, Anna. And we're going to be linking to your manual. We'll definitely collect any questions, comments, and send them back to your team. Thanks again for taking.
Thank you so much.